Hello, this is Dr. David Green, CEO of the Texas Pain Network. Today's topic is the basics of disc bulges and disc herniations. When you look at the normal intervertebral disc, it is comprised of 80% water and 20% proteins and collagen. This cartoon shows that there are two areas to the intervertebral disc. The outer layer is called the annulus fibrosus. The inner layer is called the nucleus pulposus. The outer layer does have some nerve endings, so if there's some tears and degeneration out here, that can be painful. On the inner area, the nucleus, there are no nerve endings and there's no pain that can be felt. Normally, the disc acts as an excellent shock absorber when we walk, run, jump, bend, twist. It absorbs shock by pushing out water and then pulling the water back in. When disc degeneration starts to occur, it's usually between the ages of 20s to the 50s. There are some risk factors: obesity, smoking, repetitive trauma, genetics, and social and environmental factors. One example would be if you're a truck driver and you have all these little repetitive micro traumas over 2 decades, it's probably going to lead to potentially some disc degeneration. What this does is it leads to loss of fluid in your discs over time, subsequent loss of height in the discs, and then some tiny tears or cracks in the annulus, the outer layer, which can lead to pain. You can actually see that here in this cartoon. Here's a healthy looking disc, nice rectangular, and you start to lose height from loss of fluid, you start to get some bulging, and then here it's almost all gone. Basically this layer, this vertebral body is about to fuse to the one below it. So it's almost like a tire losing air. When a tire starts to lose air, it starts to bulge out. On this MRI you can see that, decent sized bulge there, okay? There have been some studies done. 35% of those between the ages of 20 and 40 have degenerative disc disease on MRI and no back pain at all. So it is a normal sign of aging. It's not always going to cause pain. If a tear occurs in the annulus, the outer layer, it may cause considerable back pain from the irritation of those nerve endings, or it may not be painful at all. Okay, so here you see a normal looking disc, and then this is when it starts to bulge. See, if the bulge is large enough, that can actually pinch on a nerve root and cause sciatica, or it may cause no pain at all. Now, if it does actually herniate, pushes through the annulus, that can lead to sciatica. There's all kinds of names for this: slip disc, herniated nucleus pulposus, prolapsed intervertebral disc, herniated intervertebral disc. They all mean the same thing. What are the symptoms of a disc bulge and herniation? Most disc bulges don't cause any pain, as I mentioned, but if it does, it can include back pain, it could include sciatica pain, spasms and aching as a protective maneuver by your body. Disc herniation symptoms, if it pinches on a nerve root, can cause a burning, searing pain down the leg, pins and needle sensation, possibly some numbness. Can have some motor weakness, and rarely it can lead to incontinence. If incontinence occurs, that becomes a surgical emergency. It needs to be operated on within 24 hours. So what are the treatments? Oftentimes benign neglect. If it's not hurting that bad, you can kind of just watch it, and if it continues to get worse, then you can start active treatment. Over-the-counter medications should be tried first, very simple, anti-inflammatories and Tylenol. Physical therapy may be of benefit. Chiropractic treatment along with spinal decompression therapy, which is computerized intermittent traction. When you start getting into prescription medications, once in a while a Medrol dose pack, which is a burst of prednisone with a taper, can help. Narcotics or non-narcotic medications like tramadol can be helpful. Chronic narcotics for degenerative disc disease is just not a very good idea. The risks start to outweigh the benefits. Muscle relaxers can be helpful, neuropathic medications such as Neurontin or Lyrica, and then topical prescription pain creams or patches. When it comes to interventional treatments, trigger point injections can help. There are superficial injections that are good for spasms or aching relief. Intradiscal injections, such as with steroid, and possibly some PRP therapy or stem cell into the disc can help with regeneration. What you see here is an epidural injection. You have a herniated disc here pinching on a nerve. This epidural provides soothing steroid around that and can relieve pain for weeks to months. It actually doesn't fix the problem, but it can maybe mask the pain long enough to where this little piece of disc disintegrates. The outcomes of a disc bulge and herniation: over 3/4 of individuals who have degenerative disc disease symptoms are able to avoid the need for surgery. Out of those with sciatica symptoms due to either a pinched nerve or irritation from an annular tear, over 95% of patients are able to avoid the need for surgery. There was a big study back in 2006 from the American Medical Association that showed outcomes at 1 year with either operative or non-operative treatment for a disc herniation were no different. So if surgery can be avoided, the outcome is going to be no different typically at 1 year. The top non-operative pain management in Texas is through the Texas Pain Network. There are several clinics throughout the state, including Austin, accepting over 50 insurances and providing over 25 treatment options. Very high success rates with the board-certified physicians. In the Austin area, visit us online at painmanagementaustintx.com and then call us for more information and scheduling at 512-456-8886. I'm Dr. David Green with the Texas Pain Network. Your pain stops here.